So NAD stands for nicotinamide adenine dinucleotide, and it is a critical cofactor in the body that is involved in hundreds and hundreds of processes throughout the body. So one of my favorite things about NAD is that it has an almost linear effect on the amount of ATP produced in the body. ATP is our body's energy molecule, and ATP simply can't be made without NAD. And patients come in to the clinic all the time complaining of fatigue. It's actually one of the most common symptoms that I hear is I'm fatigued, I'm tired, I don't have enough energy. And fatigue is a really tricky symptom because it can come about from a variety of different dysfunction in the body, and sometimes many dysfunctions at once create fatigue or chronic fatigue. But one underlying core issue about energy production and fatigue is if the body doesn't have enough NAD, it simply cannot produce enough ATP or enough energy. So that's at the base. If you are feeling fatigued, if you are feeling like you don't have enough energy, it's likely that you don't have enough NAD. And as a naturopathic doctor, I work towards finding what the root cause of the fatigue is and working on those systems that can naturally help the body produce more NAD. But during that time, NAD therapy could be a really great therapy to help boost the energy while we figure out why the lack of energy is existing there. People who are pushing their bodies harder and harder and harder are really depleting their body of NAD much faster. And while in most cases athletes are taking extremely good care of their body, many times there'll be a time where they'll hit a plateau or their workouts just aren't producing the same results that they used to be producing. And sometimes that's because they're utilizing all the energy that they possibly have to get to a certain level. And sometimes by adding a little bit of NAD to the body, it can give a little bit of a boost to the performance so that either the athlete can perform at a slightly higher level, or when they're in their recovery mode, that's a good time to give NAD too, because typically if athletes have performed at a very high level for a long time and now they're in kind of that recovery mode, their NAD and their energy has been depleted from their body. So their following workouts can become more and more difficult. So by adding NAD to the body, it allows the athlete to generate more energy so that they can recover and get back to their normal routine quicker. One of the uses for NAD is to boost the metabolism. So I often think of the patient who has been trying to lose weight, has been trying to boost their metabolism and just operate at a higher level of functioning as a good candidate for NAD. Now I will preface that by saying that typically the patients that I look for as candidates for NAD therapy when they're trying to boost the metabolism are patients who've already consulted with their doctor, primary care, healthcare provider to be following the right diet, to be exercising, to be leading at least a fairly healthy lifestyle that would also help with weight loss and boosting metabolism. But if they're looking for an additional therapy or an additional boost, NAD is a great place to start because NAD is involved in redox reactions, which are the reactions that lead to energy production, again to ATP production. So NAD is really important in the metabolism of carbs, turning carbohydrates into sugar that can be used by the brain and the muscles and all of the energies in the cell. The more efficiently your body can do that to turn the carbohydrates into usable sugar that the cells can use quickly, the faster your metabolism works. Another great effect of NAD is that it has an impact on our cognitive function, which is our mental well-being, our mental emotional well-being. NAD is essential to the production of our neurotransmitters, including dopamine, serotonin, and noradrenaline. All of these neurotransmitters contribute to a positive mood and a balanced mental emotional peace. Some of the effects that people who have had NAD therapy report is an increase in concentration, an elevation in mood, increase in mental clarity, an increase in memory, both being able to retain the information and recall the information later, and an increase in motivation. So if you are one of those people who is experiencing brain fog or any part of the brain fog picture, and you just feel like you need a little bit of boost in mental clarity or focus or alertness, NAD could possibly be an option. So NAD is typically administered through an IV, and it is a longer infusion. So if you decide that NAD therapy might be something that you want to explore, the process would be you would come in maybe 30 minutes before your appointment so that I could talk to you and see what your individual needs and goals with NAD therapy are. And then you would be connected to an IV line, and the NAD would be administered through an IV. It will be a longer infusion, and typically we can drip the IV as fast as your body will accept it, meaning that there are some side effects that are associated with the infusion, but only with the infusion if it's going a little bit too fast. So some patients will report having a slightly elevated heart rate or a little bit of a feeling of a fast heart rate, a little bit of chest tightness or shortness of breath, all very mild. Some people experience a little bit of stomach upset or nausea, but all of this can be controlled by simply turning down the rate at which we infuse the NAD. And these effects are transient. Most people report positive effects with NAD, sometimes the day of, and then really when to look for the effects is the following week. So the next day, the next few days. Typically, I like to create a program for patients, so it could look anything like once to twice a week for NAD infusions for a period of 4 or 5 weeks, and then slowly extend them out. So whereas you might need an NAD infusion once a week for the first month, it may be extended out to every other week or even just once a month.